All right, today we're jumping into something that's absolutely critical in obstetrics, electronic fetal monitoring. My goal here is to help you break down that wavy line you see on the screen so you can learn to read it like an absolute pro. Let's get right into it.
You know, when it comes right down to it, this is the one question we're trying to answer. It kind of perfectly captures the entire goal of fetal monitoring. Is the baby just doing great in there, totally vibing, or are they sending out an SOS? By the end of this, you'll know exactly how to tell the difference.
Okay, first things first. Before we get into the complicated stuff, we have to understand the fundamental vital signs on this strip. Let's start with the basics of that wavy line. So that top line you see on the strip, that's the fetal heart rate, or FHR. The normal range, where we want to see it hanging out, is between 110 and 160 beats per minute. Now, if it's consistently shooting above 160, that's called tachycardia. And if it's dipping below 110, that's bradycardia. Both of those can be early red flags for fetal stress. Now, let's zoom in a little bit on this idea of variability. This isn't just about the average heart rate. It's about the tiny beat-to-beat changes, that little wiggle in the line. And I'm telling you, that wiggle is the single best sign we have of how well the baby's brain and heart are getting oxygen. It's so important.
So if a wiggle is good, it makes sense that a flat line is, well, it's bad. This is what we call absent variability. When you see this, it's telling us that the baby's nervous system might be compromised. This is a major warning sign.
Next up, we have minimal variability. This means, yeah, there's a little bit of a wiggle, but not much. We're talking 5 beats per minute or less. It's not that scary flat line, but it's definitely not what we want to see, and it means we need to keep a very close eye on things. And here it is. This is the goal, the sweet spot. This is moderate variability, with a nice, healthy fluctuation between 6 and 25 beats per minute. This pattern is just beautiful. It shows a healthy, well-oxygenated baby, whose nervous system is firing on all cylinders. This is exactly what we want to see. Then, on the other end of the spectrum, you've got marked variability. This is where the line is just jumping all over the place, more than 25 beats per minute. While it's not as immediately scary as a flat line, it's still an exaggerated pattern that tells us something isn't quite right and it needs our attention.
Okay, I get it. That's a lot to remember about wiggles and lines. So how in the world do you keep it all straight, especially when things get stressful? Well, there's an incredible tool for that.
This is the key question, right? When you're looking at that strip, you need to connect the pattern you're seeing with what's causing it, and then figure out the right thing to do, and you need to do it fast. So, meet your new best friend, the Veal Chop My mnemonic. This thing is absolute NCLEX gold for remembering what to do. It just lines everything up perfectly. Let's just walk through it real quick. Variable decels are caused by cord compression, so the first intervention is to move the mom. Early decels are from head compression, so you just identify it. Accelerations mean oxygenation is okay, so you do nothing. And late decels mean placental insufficiency, which is an emergency. Seriously, commit this to memory. It's a lifesaver. All right, now let's put that awesome mnemonic to work and break down what these decelerations actually look like on the strip. These are the patterns that tell us something specific is going on with the baby. First up is an early deceleration. You'll notice it's a gentle, kind of gradual dip in the baby's heart rate that perfectly mirrors the uterine contraction happening right below it. As the contraction starts, the heart rate drifts down. As it ends, the heart rate comes right back up. This is just caused by the baby's head getting a little squeezed during a contraction. And just like our mnemonic says, E is for early, H is for head, this is a completely normal expected finding, especially as labor moves along. It is not a sign of distress. So what do you do about it? Well, here's the crucial part. You don't really do much. You simply identify the pattern, you document it in the chart, and you keep on monitoring. No emergency bells are ringing here at all. Okay, now this is different. A variable deceleration is a really sharp, abrupt drop in the heart rate. It doesn't mirror the contraction, it can happen pretty much any time. The shape is the big giveaway. They often look like a U, a V, or a W. And this is caused by the umbilical cord being compressed. So let's go back to our cheat sheet. V is for variable, C is for cord compression. The second you see that sharp V shape, your brain should immediately think cord. And our mnemonic tells us exactly what to do first. M for move mama. A lot of the time, just repositioning the mother onto her side can take the pressure right off the cord, and the problem resolves almost instantly.
If that doesn't quite do the trick, you'd move on to giving oxygen and increasing IV fluids to improve blood flow.
All right, now this is the one you really need to worry about. A late deceleration is a gradual dip in the heart rate, but the absolute key here is its timing. It starts after the peak of the contraction. That little delay is a huge critical sign that the placenta isn't delivering enough oxygen to the baby.
And when you see a late deceleration, you don't just watch, you act, and you act immediately. This brings us to the most critical part of this whole explainer, the emergency protocol. This is an emergency. No two ways about it. Late decelerations mean the baby is not getting the oxygen it needs to survive. L is for late, P is for placental insufficiency, and E is for emergency.
And what do you do in an emergency? You follow the poison protocol. P, position the patient on their left side to get maximum blood flow to the placenta. O, oxytocin, off. You got to stop the contractions to reduce stress. I, IV fluid bolus to increase mom's blood volume. S, sterile vaginal exam to see what's going on. O, oxygen 10 liters through a mask to saturate the mother's blood. And finally, N, notify the provider immediately. This is the critical response.
So we've covered the baseline, variability, and all the different decelerations. Now let's pull all of this together into a clear framework that's actually used in practice to make judgments. Fetal heart tracings get classified into 3 categories. Category 1 is our good-to-go strip. That's a normal baseline, that beautiful moderate variability that we love to see, and no late or variable decelerations. On the flip side, you have Category 3. This is an emergency. This is when you see that terrifying absent variability combined with recurrent late or variable decels, or a persistent bradycardia. This requires immediate, decisive action.
So there you have it. You have the code to decode the fetal heart monitoring strip. From a simple wiggle to a complex emergency protocol, you now have the foundational knowledge to understand what that wavy line is really telling you. So the only question left is, are you ready to trust it?